Hello, my students. Today's our topic is the clavicle, the first bone of the upper limb, we can say. Today, I'm going to tell you about the anatomical position, the side determination, the peculiar features, the muscle origins, and insertions of the clavicle. Firstly, clavicle is the long horizontally located bone which transmits the weight of the limb to the sternum. It has the curved part and two ends. The curved part is known as shaft. This is the shaft, and the two ends are the medial end and the lateral end. The medial end is also called the sternal end. The lateral end is also called the acromial end. This one. And we have the acromial facet here and the sternal facet here. The shaft is also divided into the medial 2/3 and the lateral 1/3. Coming to the anatomical position and the side determination, you have to hold the clavicle in such a way that the lateral end is flat and the medial end is large and quadrilateral. Also, the concavity, this is the concavity, the lateral 1/3 facing outwards, and the convexity of the medial 2/3 facing inwards. After determining the sides, you have to hold it in the anatomical position, which means the coming to the medial and lateral sides, the superior surface is smooth and the inferior surface is irregular. The superior surface is smooth and regular. The inferior surface is irregular. You can feel the roughness in the inferior surface, and also at the posterior inferior surface of the lateral 1/3 you have a elevation, this thing, which is called the conoid tubercle. This is it. This is the conoid tubercle you can see on the inferior surface. When you're holding this, it can be seen in the inferior surface. With the downwards, you can feel it. This is this anterior border and this is the posterior border. This is the superior view. And coming to the inferior view, you can see the conoid tubercle, which is like a ridge, and also this is the trapezoid ridge actually. Trapezoid ridge. These are the identification marks: conoid tubercle, the trapezoid ridge, and the nutrient foramen. You can find the trapezoid ridge and conoid tubercle in the lateral 1/3 of the clavicle, whereas the nutrient foramen in the medial 2/3 of the clavicle. Also, in the medial lateral half of the medial 2/3 of the clavicle, you can find this subclavian groove. And this is nothing but the impression of the costoclavicular ligament which attaches to the first strip of the clavicle and to the conoid tubercle and the trapezoid ridge. That's all about the identification marks and the anatomical position and the side determination. Coming to its peculiarities, you have it's the long horizontal bone which is subcutaneous, and it's the first bone to start ossifying and the only long bone with the membranous ossification. It has two primary centers of ossification. About the medullary cavity, it is given different in different books, but according to the BDC, you have the absence of medullary cavity in the lateral 1/3, whereas the medial 2/3 is kind of thick, right? Or kind of broad, wide, you can say, so that it has the medullary cavity. Coming to the muscle insertions and origins, you have the lateral 1/3 and the medial 2/3, right? Coming to the lateral 1/3, you have on the anterior border you have the origin of the deltoid, and whereas the posterior border it gives the insertion for the trapezius muscle, right? On the anterior surface you have the origin of the deltoid, and on the posterior surface it gives the insertion for trapezius muscle. That's all about the lateral 1/3 of the clavicle. Coming to the medial 2/3, it gives both origin and insertions to certain muscles. Here the redly showing out the origins and the blue colored are the insertions. Medial 2/3 has the four surfaces: anterior, posterior, superior and inferior surfaces, whereas the lateral 1/3 has only the anterior and posterior borders and superior and inferior surfaces. Coming to the medial 2/3, you have on the anterior surface you have the pectoralis major, whereas on the posterior surface you have the sternohyoid muscle. Coming to the superior surface, you have the origin of the sternocleidomastoid, whereas the inferior surface you have the insertion of the subclavius and clavipectoral fascia, you can also say. So coming to the medial two-third, you have on the anterior surface you have the pectoralis major origin, and on the posterior surface you have the origin of the sternohyoid muscle, and on the superior surface you have the origin of the sternocleidomastoid. On the inferior surface you have the insertion for the subclavius, and also on the lateral one-third in the inferior surface you have this trapezoid part and conoid part. These two are involved in the corticoclavicular ligament formation, which you learn in the joints of the upper limb later. Yeah, so that's all about the overall clavicle bone. Also, for the clinical anatomy, you have the clavicle bone is commonly fractured, and the junction between the two curvatures of the bone is the weakest point, where the most fractures are more prone to occur. If it is cut in between the two curvatures, if it is cut, and we have the treatment which is called the eight splint, where the bone is broken into half and we give them a belt like thing to hold the shoulders in the position. I can show you the picture. This is the figure of the eight splint, figure of eight splint and brace. There is also one more case called the cleidocranial dysostosis, in which clavicles are absent, and that's all about the clinical anatomy, and that's all about the overall bone. Do like and subscribe. Thank you, guys.